I'm going to just make nice at first, and I'm just kind of mobilizing across her wrist and then her carpals just to see how that feels. I'm going to work out to each finger. Typically, they would say this is working like the fan lines of the hand. Those sun lines, they exit out the 5 fingers. Somebody asked me once what a mudra was. You guys know what mudra is? Yeah. And I said, it's a yogic gang sign. Do you see the mix of like East and West? Like, I just think it's funny. So how's this?
Okay, good.
This is just to make sure she's like soft and relaxed. A lot of people are having the problem. I'll always jokingly call this the crabby claw. It's this junction between the thumbs, so it's like thenar eminence, what is it, adductor pollicis, I forget the names of the muscles that all go right through there. But I'll come in right here just to feel my way around. How's this? Oof. Not too much right there? Would I come in, and do you guys do this often, do you come in and put pressure in here with like an elbow? Do you guys do that with clients very often? How's this on your hand and wrist right there? Okay. Back towards the wrist or out towards the fingers? Towards the fingers. Now up towards the thumb or down towards the pinky? Up towards the thumb? Right there? There we go. So underneath my hand, here's what I want you to do. Can you try to spread? There you go. And then you can do that as much or as little as you want. So it's kind of like pin and stretch for that area, right? Now I'm gonna slowly back off. You'll notice that instead of keeping her hand down on the table, I actually put it on my thigh. I really like this sort of passive contact. I've gotten really, really comfortable with physical intimacy with people in session. If that doesn't work for you, it's totally fine. Could I put a towel down and then? Yeah, same basic idea. Now, would I want to use a knee right here?
Probably not.
Really? What kind of world do y'all live in? So, how big is my knee compared to my elbow?
Much bigger.
Much bigger. Okay. So, now here's the other thing, and I'm going to point this out before I put any real pressure on. I don't want to like grab here and then be fast, rapid. Like how big are these ligaments and structures compared to like what's in the hip? Small. And I'm using a big tool now. It's like a big wrecking ball comparatively. So I want to go slow, but I make sure palm is open. Right. Is that too much? Okay. Now, right there, if I go down towards the fingers or up towards the wrist? Towards the wrist. Is that too much right there? Okay. What, a little more lateral? Right there? A little more pressure right there? How's that?
Here.
Good. Can you open your hand up for me now?
Yeah, that's already open actually.
Which one would you prefer? Would you prefer this or the elbow?
Don't know. It's different.
Different? Is this less intense?
This one is less intense. Yeah.
And it's less intense just because it's a bigger, broader structure, right? Now, I'm backing off very, very slowly. I could use either of those. Mainly what I'm focusing on is right here in what I would call the thenar eminence, just this little junction right here. Now, I can always come back with my hands and do a little spot work just to check. Sometimes I'll have more issues right here along the thumb. I can cross fiber friction through there. A lot of people will start to have issues in both sides, and here's what'll happen. I'll grab right in here, what I call their crabby claw, and start to shake them out. How's that?
Okay, good, yeah. It's intense, but...
And then there'll be one more piece before we trade some of this. So feel free. If you don't like the elbow, you can use the knee. If you don't like the knee, you can use the elbow. How's that?
Very good, yeah.
Very good. Is it referring pain anywhere?
No.
You just feel that we're impressing?
Yeah, just to...
Okay. So you have dorsal interossei. And I just say that because it makes me sound smart. They're muscles between the carpals right here that if you hook like a fingertip Like I can feel it run down to my fingertip right there. You have a first dorsal interosseous, which I tell people is a no, not yes, no, that muscle. I'm going to hook my thumb right right there. Is it too much?
No, it's not too much, but it's intense.
Okay. Are you getting any referred pain?
I'm not sure
It's not like running down your fingers or going up your arm?
Yeah, I
Same line.
yeah.
Same line. Because people just have experience. Anatomy and physiology does not really change from here to Thailand, I promise. Right? So here's what I'm going to do. I'm going to lengthen her pointer finger. It's maybe a little harder to see this. I'm going to pin and stretch that first dorsal interosseous, and I'm slowly working my way up towards, I guess more like the saddle joint. I don't know if that's what it's called. It's up towards the wrist.